our facility foot care program for retirement and long-term care homes. You've been on your feet all day as a nurse tending to residents, and now they ache something fierce. Your heels feel cracked, your toes cramped. Working in a care facility means always being on the go to provide compassionate care. But who's taking care of you? Your feet carry you through long shifts where you're constantly moving between patient rooms, yet they often get overlooked. Let Advanced Foot Care and Wellness Center lend a hand, or foot rather. Their team of qualified nurses will come to your facility and provide specialized assessments and treatments to give your hardworking feet some well-deserved TLC. With their caring approach and commitment to quality care, you can trust that your feet are in good hands. So take care of those who take care of others by bringing Advanced Foot Care into your facility for a foot care program that shows your staff and their feet some love. Why foot care is so important for retirement and LTC residents. Your facility likely has a lot of residents who can no longer properly care for their feet on their own. Our foot care nurses are trained to handle a wide range of foot care needs to help keep your residents comfortable and mobile. Assessments and treatment plans. Our nurses will conduct an initial foot assessment for each resident to evaluate any conditions present and determine an appropriate treatment plan. We look at risk factors like diabetes, poor circulation, mobility issues, and hygiene challenges to develop a plan that addresses each resident's unique needs. Professional foot care. Our nurses trim and file nails, treat ingrown toenails, corns and calluses, and moisturize and massage feet. We can also fit residents for prescription orthotics if needed. Your residents will receive the highest quality professional foot care to keep their feet healthy and pain-free. Education and risk management. We work closely with your staff to help educate them on proper foot care techniques and risk factors to watch for between our visits. Our goal is to empower your staff and residents to better manage foot care in a way that prevents issues before they start. Peace of mind. By relying on our experienced foot care nurses, you can have confidence knowing your residents' feet are in good hands. Our facility foot care program delivers just that. Contact us today to learn more about how we can keep your residents happy, mobile, and foot pain-free. What our expert, LTC nursing foot care services include. If you or a loved one lives in a long-term care facility, foot care should be a top priority. Your feet bear the weight of your entire body all day, so keeping them healthy and pain-free is essential for mobility, independence, and overall well-being. Preventing infection. Many LTC residents have conditions like diabetes or poor circulation that make them more prone to foot injuries and infections. Professional foot care helps detect any wounds or ulcers early and treat them properly to avoid dangerous infections. Regular nail trimming, filing, and cleaning also reduce the risk of ingrown toenails that can lead to infection. Improving mobility. Healthy, pain-free feet are necessary for walking and staying active. Residents with conditions like arthritis, bunions, or heel pain will benefit greatly from professional foot care. When feet look and feel their best, it helps LTC residents maintain their dignity and independence. Professional foot care is essential for the health, happiness, and quality of life of LTC residents. Be sure to ask about foot care services at facilities you're considering and look for options that employ specialized foot care nurses. Your feet will thank you, providing convenient on-site care at your facility. We check for signs of infection, injury, poor circulation, as well as nail and skin care needs. Preventative care is essential, so we aim to detect any issues early and recommend appropriate treatment. Nail trimming and filing untrimmed nails can lead to injuries, pain, and mobility issues. Our nurses trim and file residents' nails to promote foot health and comfort. We use proper sanitation and tools to avoid injury and infection. For those with conditions like diabetes or poor circulation, nail care is especially important. Corn and callus removal. If left untreated, they can become painful, inflamed, and in severe cases lead to ulceration. We take extra care for those with sensitive feet or health conditions. For residents at risk of developing ulcers, especially those with diabetes, our nurses provide comprehensive assessments, advice, and treatment. Catching ulcers early is critical to avoiding hospitalization. Better care, better communication, better organization, better outcomes. That is our promise. Better foot care leads to better health and well-being. Keeping residents' feet healthy and pain-free is a top priority. That's why we offer convenient on-site foot care at your facility. Our foot care nurses come directly to you, so residents don't have to travel off-site for appointments. Regular visits and assessments. Our foot care nurses visit facilities on a regular schedule, typically every 4 to 6 weeks. During each visit, they perform foot assessments on all residents to check for any issues and provide basic foot care like nail trimming, callus removal, and moisturizing treatments. For any problems detected, our nurses determine appropriate treatment and care plans to address them. Individualized care plans. For residents with chronic conditions like diabetes, our nurses develop individualized care plans to monitor their feet, reduce complications, and keep them as healthy as possible. Care plans may include recommendations for proper footwear, orthotics, or wound care. Our nurses reassess care plans with each visit to determine if any changes need to be made based on a resident's condition and needs. An important part of our role is educating residents and staff on proper foot care and hygiene. Our nurses provide useful tips on topics such as choosing appropriate socks and slippers, moisturizing and massaging feet daily, inspecting feet regularly for any changes, keeping feet elevated and avoiding prolonged standing or sitting. By coming directly to your facility, our foot care nurses make complete foot assessments and care convenient and accessible for your residents. Our regular on-site visits, individualized care plans, and education help ensure your residents maintain healthy, pain-free feet so they can continue to live active and independent lives.